Hi, it's Glen Macnow from WIP Radio. Very proud to be representing Philadelphia's CyberKnife. We're here today with Dr. Rachelle Lanciano, Head of Clinical Research here at CyberKnife. Doctor, this is an amazing technology you have here at Philadelphia CyberKnife. Explain to us how this works.
Well, you know, it's a radiation machine, and so this is a specific machine that can tailor the radiation to a very small volume, treating the tumor to a very high dose and sparing the normal tissues surrounding the tumor. And because it's the linear accelerator is part of a robot, we can actually come in various positions so that we can treat the tumor from many angles.
You have a small model there. Yeah, show
us. This is an example of our robot. The robot is quite large, and it's like the robots they use to make cars in Detroit. This part is the miniature linear accelerator that makes the radiation. And it can come into various positions under the patient, above the patient, left and right. And we usually use hundreds of beamlets, all converging at the tumor. That really gives us the full dose at the tumor and spares the normal tissues, because no one beam is going to go through the normal tissues more than once. So you have them all converging at the tumor, giving a nice high dose. The other thing that's very important about this machine that none of the other machines that do this type of radiation can do is that it can track the tumor during respiration. So we have the patient with a monitor on their chest, and as they breathe, we can see their respiratory motion, and at the same time in the ceiling are cameras that we can watch the tumor, and we can watch the tumor move. We build a model of how the tumor moves with respiration, and the machine will then accommodate and move with the breathing.
So it can be as exact as it can be.
This is a patient with lung cancer, and in this example, we were able to see the tumor with the cameras in the ceiling, and we were able to come in with beams, and these are beams coming in from all different directions. And this is the dose distribution that you can have. Here's the tumor, and you can see the tumor is very close to critical structures, being the great blood vessels, the heart, the lungs. And when you're treating these patients, we want to minimize all those normal structures. And you can see it in 3 dimensions.
Mm-hmm. Doctor, tell us more about what kinds of research you're doing here at Philadelphia CyberKnife.
We have 3 different types of research that we're doing here. They're all outcomes research, and because we were the first CyberKnife in the area, we have a lot of experience, and we felt it was important that we publish and look at our experience so that we know what our results are. And in the very beginning, there was very little in the literature to help guide us. So we were part of the process of developing what is the standard of care for this technology. So we started early on with prostate cancer and lung cancer, which are 2 very common cancers that we see, one of the 4 most common cancers that we see in men and women. And one of the things that we're looking at is this technology where we give 5 treatments, and that's it for prostate cancer, is that equivalent to the 40 treatments that's the more conventional way of giving radiation for prostate cancer? And we have just submitted an abstract to ASTRO, which is our national meeting for radiation therapy, and we're waiting to see if that gets accepted.
Doctor, research is very expensive. It is very time consuming. Why is it important for Philadelphia CyberKnife to be part of research?
Well, I think because we were the leader in this area, we have a commitment to doing research. And you know, I have a commitment to doing it. When I was in my training, and I trained at Penn and Fox Chase, that's part of my inbreeding. You do research so that you make sure that what you're doing is really helping the patient. So we have a commitment, and we have students that we're kind of coaching through this to help them with their careers as well.
Doctor, how do you think the process has benefited from all of the research that you've collected?
I think it's been great for us, because we know what we have become very adept at treating patients well. We know what our results are, and so we're comfortable with treating new things and expanding our horizons.
Dr. Lanciano, so tell us, what's the goal moving forward with all the research?
I hope that we will be able to take these to phase 3 trials, that all of our studies that show our outcome take it to phase 3 trials and really change the pattern of care in cancer, help be able to make a difference in our patients' lives.
Dr. Lanciano, thank you so much for all of your time and expertise, and everyone, for more information, go to phillycyberknife.com.